Hello, my name is Lauren Hyman, and welcome to Scooch Down, where you can talk to your gynecologist like you talk to your friends. I often have patients coming in for their annual exam and tell me that they are considering getting pregnant over the next year. How exciting! They want to know what they can do to help increase their chances of getting pregnant and what they need to know in order to make sure their body is as healthy as possible before they start trying to conceive. Well, the first thing is you want to make sure you are on a prenatal vitamin or a multivitamin with folic acid in it. Folic acid helps decrease birth defects, specifically defects in the spinal cord like spina bifida. You want to be on some type of a folic acid, again in a prenatal vitamin or a multivitamin, for at least a month before you try to get pregnant. Also, you want to be at your ideal body weight. If you start the pregnancy heavy, you're at a higher risk to developing diabetes or hypertension during your pregnancy, and that can complicate things. Your ideal body weight should be obtained by exercising, eating right, and it'll also help you regulate your periods and to be ovulating normally, and that will go a very long way to actually getting pregnant in the first place. Before you try to get pregnant, you also want to make sure that you are already immune to measles, mumps, rubella, specifically rubella, which we used to call the German measles, and varicella or chickenpox. Most people were either vaccinated against these illnesses or contracted these illnesses as a child and are therefore immune. But a simple blood test can let you know that you already are immune. If you're not, you should be vaccinated and wait 3 months before trying to get pregnant. If you contract any of these infections during pregnancy, it can be devastating, so you want to make sure it's not an issue before you start. Finally, there are some people who have inherited genetic conditions that they are carriers for and are unaware that they are carriers. Some examples might be cystic fibrosis, Tay-Sachs, or sickle cell anemia, and some of these conditions run predominantly in different ethnic groups. Your doctor can recommend a blood test for you to make sure that you do not have any carrier status for these diseases. If you do, then your partner will want to be tested as well to make sure that there is no chance that both of you can be passing a gene down to a baby and that you would have an affected child. These are some of the things you want to do before even thinking about starting to get pregnant, so that when you do get pregnant, your pregnancy is as absolutely healthy as possible. This is Dr. Lauren Hyman, and this is Scooch Down.